And here is your question. Okay, so if you have read and understood, considering it critical care scenario, please tell me how would you manage this patient now?
I will manage this patient on the basis of critical or surgical consensus protocol.
Okay,
Patient, patient, I will follow the airway breathing circulation and possibility protocol.
yes,
Consulting the patient is the patient is talking to me. I will consider the airway patient, and then I will move on to the breathing pattern. If the breathing is there is a tachypnea or there is shallow, there is a saturation is low on the lower side. I will and the patient will be having a severe pain because of sleeping there could be tachypnea, and I will immediately attach the oxygen supply to the patient, high flow oxygen, and then on the circulation, and on the
okay.
circulation,
Your
yes,
patient is in semi-conscious condition, but in severe pain. So once you've done the chest X-ray, it shows the gas under the diaphragm. What would you do next? What would be your next action, plan of action?
I will prepare the patient first of all. Yes, I will uh, insert the maintain the circulation of the patient, insert the viable kernel on the
Good.
on the whiteboard kernel
And
on both the critical fossils and take the blood samples, as well as start the crystalloids,
yes,
and I will cross match the blood 4 to 6 minutes.
what is more
Blood
important?
grouping fluid resuscitation is the most important.
While you're resuscitating, what else would you make sure that you're doing or you've already done? Inform the
I will inform my consultant.
other than your consultant. How should ideally gas under the diaphragm be managed?
It is first of all, patient is shifted in the HDU and central line inserted. Catheterization is done and send the blood samples.
Yes, but you would have to prepare surgery for the patient and you would have to
Right.
inform the anesthetics, right? So they
Okay.
can come
Right.
and they can judge or evaluate the patient, right? So while you're managing, while you're securing the cannula and resuscitating the patient with ringer lactate, you're informing the anesthetics. Okay,
Yes.
this is the patient and I'm resuscitating while you can come and observe your patient and do whatever you have to do in order to save the patient. Can you tell me what is the mechanism of action of non-steroidal anti-inflammatory drugs which this patient was taking in causing peptic ulcer perforation? How does it
Yes.
occur?
Uh, and it blocks the production of the prostaglandins,
Yes,
and it is due to and other possible reasons that there is the possible topical tent effects of the drugs,
yes,
uh, and it is the mucosal blood flow, and
okay,
it hampers the that repair process, the gastric mucosal repair process,
yes,
and And one more point is it
Was
it uh, it uh, it 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 inhibits the gastric mucosa. It
yes,
destroys gastric protective barrier that gastric mucosa.
yes, and it also suppresses the prostaglandin synthesis in the stomach,
Yes.
right? Okay, you've already informed the anesthetics. So what should be the management options that you can offer or can do to this patient in order to repair the perforation, gastric ulcer perforation?
Yes. First of all, a mental patch can during the
Yes,
surgery, a mental patch repair can be done along with the gastric lavage, thorough gastric lavage,
yes,
and and the drainage,
yes,
intra-abdominal drainage is what if I'm repairing the gastric perforation, I will take the biopsy from the margins of the
very good. Yes,
perforation to rule out malignancy.
yes. Okay. Post-operatively, what measures would you take or what advice would you give to the patient?
Post-operatively, patient may require the long-term PPIs, proton pump inhibitors,
Uh,
and I will
don't use abbreviations, proton
okay,
pump
right,
inhibitors. Yes. Okay.
proton
Uh,
pump.
What is the mechanism of action of proton pump inhibitors?
Proton pump inhibitors act on the gastric parietal cells. They inhibit the hydrogen potassium ATPase pump. So that in this way they will inhibit the HCl release into the lumen, thereby combining with the covalents to form the hydrochloric acid.
Okay. So how would you summarize what is the action of hydrochloric acid?
It will result in the hydrochloric acids. First of all, it is a proteolytic. It will activate the enterokinase enzymes, some enzymes which are involved in the digestion of the proteins, as well as it is a bacteriolytic enzyme, and
And
it will also activate the release of the cholecystokinin as well as secretin from the small bowel, and it will. One more point was that uh, uh, it helps in the absorption of calcium and iron from the small bowel.
yeah. So what are the phases of gastric secretion?
And there
How
are four
gastric
phases.
secretion is regulated?
There are three phases. First of all, cephalic, gastric, as well as intestinal phase.
Yes.
Uh, in cephalic phase constitutes the 30% of the gastric acid production. It is stimulated by the taste and smell of the food. And next is the gastric phase. It contributes 70% production of the uh, gastric acid. It is due to the gastric. It is stimulated by distension of the gastric acid as well as the increase and the acidity of the stomach.
Yes.
And the third phase is intestinal phase, which contributes 10%, which is it is it stimulates the secretion of polysaccharidine and secretion secreted.
Okay. There's one classification which is used for the to prioritize the patients for operation theater lifting. Can you name that classification and tell me how grades are being given in that listing?
The classification is called national confidential inquiry and national confidential
Yes.
inquiry into patient outcome and death.
Yes.
NCEPO classification, and it is differentiated into the urgent, immediate, and expedite, and elective. In
Okay.
urgent, in first urgent category,
First is immediate.
what's it? Right, yes, yes. First is
Yes.
imaging.
Can you give an
First is imaging.
example of an condition which comes or falls under the immediate category?
Yes, in aortic rupture
Yes.
are like
Or
this
like this
situation.
one?
Like this one, we would do surgery and
Viscous rupture,
resuscitation
yes.
side by side,
Right.
simultaneously.
Right. After immediate, then there is urgent, then priority, and then elective. All right. So these are, and this one, that's why it is important that you have to know that this one should be done in 0 minute, like immediately you have to plan for surgery. Good.
Yes.
Bell is gone. Thank you. And
All the
image
questions.
I asked you, maybe you can also read it to me. What do you see? You've done, just suppose you've done this chest X-ray. What does it show you?
It is showing me there is a gas, the gas one. It is on the right side,
Yeah.
as well as this, mm, and and there is a there is large air. It could be gastric ulcer or it could be duodenal ulcer.
Yeah, could be. Anything else you are observing?
The diaphragm is pulled
Up.
right side.
Yeah.
Yes, the diaphragm is on the higher side, right
Yeah.
side.
Yep. Yeah.
It could
So
be eventuation.
respiratory exposure, anything on exposure? Is it okay?
And the right side is CP angle is not visible in this case, and exposure is not
Good.
good.
Okay, good. Right. Thank you. There is also